is Aisha Ambrose, and I'm just going to be talking to you a little bit about myself today. So I'm from Suwanee, Georgia. I went to 2 different colleges. The first one was University of West Georgia. I played volleyball there for the school, and then I transferred to St. Leo University, which is about 30 minutes outside of Tampa, Florida, and I played volleyball for them as well. In both schools, I majored in biomedical biology, and as I said, I played volleyball throughout my whole undergrad career, which I feel like made me stand out just a little bit, you know, just balancing a extremely time-consuming sport and balancing that with school and maintaining high grades. And then also with volleyball, it just helped me with my manual dexterity and hand-eye coordination, which is very beneficial to dental students. So other than that, maybe a fun fact about myself, I still play volleyball. I created a rec team here at the dental school with some of my classmates, and we played 4-on-4 last spring, and this fall we're going to be playing 6-on-6. So it's just fun from going from like the player to kind of like the coach and the captain. So yeah, that's just a little bit about me. So what most got me interested in dentistry were just some of my role models. I had 2 in particular. One is my dentist, and the other one is a family friend who passed away probably 10 years ago, but he was a dentist as well. And so my dentist, she always had a positive attitude, always just made every encounter I had with her so personable and made me feel like she was just my family away from my family. So I really liked how she handled herself, and that she was always happy working, and I never seen her upset or anything. And that was something I really wanted to take into consideration when I picked some kind of occupation for myself. And I started shadowing her, and I realized that she did a lot of stuff that I found interesting, that made me think of like arts and crafts type of stuff. And so I started going down that route. And not only her, but my family friend was a dentist, and like I said, he passed away about 10 years ago, but he was also one of the people I considered like family, and he continued that family-oriented feeling with his practice, and just like the my dentist now. So they both just kind of comboed the family feeling, and I loved it, and how they held themselves after work and before work, and just being happy with themselves during it. So when I was studying for the DAT, I was also in school, as most people usually are. So what I did was made sure that I set aside an hour or 2 after classes and volleyball to study a particular subject that would be in the DAT. So for about 6 months, each week I would focus on a different subject. Like the first week I would focus on biology, and the second week I'd focus on organic chemistry, and it would just go through so that basically I would have a full month of each of the 6 categories by the end of the 6 months that I was studying. And of course you don't have to do it like 6 months like I did. I just didn't realize I had to take the DAT so soon from when I found out. But obviously if you did it like a year in advance, then you would have like two full months of studying for each section that would be on the DAT. And you know, I was lucky enough that even with 6 months of studying with volleyball and academics in the way, I still did pretty well and was able to get in on my first try. And even if you're not able to get in on your first try, you shouldn't be discouraged, because most dental students and most dentists, they always tell me that they had to take it 2 or 3 times to get the scores that they wanted. So it's not anything to be ashamed of if you don't make it the first time or get where you want to score on the first time. It's just, you know, how about how you go about studying, and then if you don't like your scores on the first time, at least you know for future reference what the DAT is going to be like. So it's just all good stuff. So what set me apart from others, I think again would have to be volleyball, just balancing that with academics and you know, still having a social life. So maintaining my grades and doing well in volleyball. But not only the fact that I could balance my time well, but again, like the hand-eye coordination that you need and knowing how hard or how soft to do stuff with your hands, because that's all dentistry is about. When you get into drilling or restoring, you're supposed to know how much pressure you're applying. You're supposed to know if you move too far, then you could nick the other tooth, and so on. So just having that sport in my life for so long, and even like arts and crafts, I would draw on the sides very seldom, but it created that sense of hand-eye coordination and awareness of how little certain movements can make a difference in what you're doing. My interview day, I don't remember the best, probably because you know, all the adrenaline was pumping and I was just, you know, nervous. But I do remember it being fairly long. I had to do mine through Zoom because this was in the midst of COVID on the rise and there was no vaccine yet and no one knew really what it was. So we had to do all this via Zoom. So I was sitting in my living room with my laptop open, just listening to the dean talk for each school I had an interview with, and just different faculty members, and learning about the schools and making sure that that school was a right fit for me, as well as them making sure I was the right fit for them. So when I got to the interview part, I interviewed with 2 different faculty, and they each had their own set of questions they asked me, and just really getting to know me, because they just, when you get to the interview portion, they are truly just trying to make sure you are who you say you are on the paper, and that you're not like, you know, just putting a face and a voice to your name on paper. And just seeing how, if you could fit into their program based on your personality and what you want. But throughout the day, it was just pretty straightforward for what they had us do. They had a schedule laid out, and we even had some breaks in between, so it wasn't just like so many hours of just them talking or us talking. And we got to ask questions as well, so it wasn't just them talking, then interviewing us, and then them talking again. So we really did get to see if that school was a good fit for us, because that's what's important, is the school and yourself making sure that you are a good fit for each other. Because if one is not, then it's just not going to work, and that's okay. And there's other schools out there that might work for you and your learning style and what you want. One major tip I would give for the interview process, which I have been guilty of not doing during these videos, is making sure you're looking at the person who you are communicating with. And for me, since I had to do it on Zoom, I had to look at the camera, not at myself, so that they knew I was paying attention and really taking into account everything they were saying. But when you're doing this in person, you really want to acknowledge them by looking them in the eye, and really, like, even if you had a question, just repeating something they said, asking questions, so they know you're truly serious about that school and not just there because you have to be there. So I applied to 8 different schools, I believe. This was about 2 years ago. So I picked the Dental College of Georgia because, one, I got in-state tuition, but also it was really close to home, and that was something I really missed my last 2 years of undergrad. Just being in Tampa, Florida, just about 7 hours away from home, even though it's not too drastic, I just really missed the proximity of my family being there within 2 hours. So those were like some really big things why I picked the Dental College of Georgia. I also picked the Dental College of Georgia because they allow the students to get into clinic a lot faster compared to a lot of other schools. We get to work on our classmates our second semester of freshman year, which is crazy, even doing like injections. And then we start working on actual patients during the spring of our sophomore year. So it's very quick paced, but you're understanding everything they want you to know. And it's nothing where you're panicked because you feel uncomfortable or anything. They truly prepare you, and that's why I picked them. So going from undergrad to dental school wasn't too drastic. I believe it wasn't because I was already doing a whole bunch between volleyball and school, just maintaining a schedule and having good time management. So when I got here to the Dental College of Georgia, I just translated that over, and it's been working pretty well for me, as well as my study style. But for a lot of people, their study style doesn't work when they get to dental school, so, and that's okay too. I had to start studying more with groups sometimes, but most often my own study style was fine. But the transition wasn't hard at all. I honestly forgot I was in dental school for a few weeks after getting here. I think the most nerve-wracking part was just meeting all your classmates and remembering their names and just wondering who you might click with. And it varied for when you clicked with somebody for different people, but everybody in our class is like a big family, and that was like amazing. So it wasn't too hard or too stressful, and everybody's just there for each other, so it's great. Typical day for the first year dental student at the Dental College of Georgia, excuse me. Every Wednesday we get out at 11:45, and it's just like a half day in case somebody has stuff to make up or, you know, the faculty have meetings. But on Mondays and Thursdays, I believe it was for first years, are the longest days when you don't get out till about 4:45 or 5, because you're in lab for about 4 hours before or after lunch. But it was never bad because the time actually flew when you're doing stuff. So it wasn't anything bad. And then also, as a first year, you have a lot of didactic courses, so you're in the classroom a lot for an hour and a half at a time, just listening to professors talk and just taking tests with them. So it wasn't necessarily anything too crazy, like outside of what you would do in undergrad, besides, you know, just longer lab days and actually having to stay like the full time to get your stuff done. But outside of that, we had just every weekend was free, and every time after 5 was free, and people would always go have food trucks outside, or just go downtown, which is about 5 minutes from the Dental College of Georgia, and just hang out, and it's a good time. What makes me most excited about going to the school is just being able to actually work on stuff with my hands so soon, and that I finally get to work on patients now, so I get to do what I've been wanting to do for the longest time. And so that's what I really enjoy. And then also seeing all my friends every day is great, because like I said before, everybody in our excuse me, see, I already switched it. In our class is like a big family, because we really are. And even though you might not get along with everybody at all times, it's just like any family. Your sibling or your parent is disagreeing with you, that's fine, but you still love each other in the end, and you'll get over it. My biggest advice to pre-dents would be not only to have like adequate time management, but also to be very well-rounded and get involved with stuff, because a lot of dental schools really look for people who want to give back to the community. And one of the things that were very important to the Dental College of Georgia is volunteer hours. So if they see that you're getting involved, giving back to the community, just doing something outside of your academics, then they will be more likely to accept you into their program, because they want to know that you're not just book smart, but you can connect with people and you actually enjoy doing stuff outside of just studying. Because I mean, we're not robots and we shouldn't be just studying and taking tests. So we should be communicating with people, helping them, giving back to the community. And that's what dentistry is all about, helping people. So again, my name is Aisha Ambrose. I'm a D2 at the Dental College of Georgia. If you need to reach out to me for whatever reason, my Instagram is Aisha Ambrose, AISHAAMBROSE. The same goes for my Facebook and my Snapchat. And if you would like to email me, if you don't have any of those social medias, my email is AishaAmbrose33@gmail.com. So AishaAmbrose33@gmail.com. And thank you again for tuning in and listening, and I appreciate all of you and hope to see you guys in dental school in the future. Bye.